So you just scheduled, or you are thinking about scheduling your child for an orthodontic consultation. I know what you're thinking. You're probably wondering, why have a consultation so early? Is my child going to need braces twice in their life when maybe you as a parent only had it once in their life? Okay, don't worry, stay tuned. I'm gonna have all those questions answered right here. Hi there, everybody. I'm Dr. Minh, owner and orthodontist at Excelsior Orthodontics and located in Purcellville, Virginia. Today, we are going to talk about something that's really, really important for your child's dental health care needs. It is called early interceptive treatment, also known as phase 1. Before we get started, be sure to hit the like button, smash the subscribe to stay tuned for the latest and greatest orthodontic educational videos to help this channel grow. What is early braces treatment? Well, phase 1 treatment is designed for children who are still in the early stages of dental development. This typically occurs between the ages of 7 and 10. But why is it important to start treatment so early? By starting treatment early, we can address problems that might make things more complex and troublesome later on as your child ages. What are some problems that we may run into? Severe crowding of teeth, which can lead to impaction of permanent teeth. Basically, when permanent teeth actually erupt into the roof of the mouth trying to get in place. Crossbites. Anterior crossbite, posterior crossbite, where the teeth actually fit on the inside of the lower teeth, doesn't make a comfortable spot for the jaws to actually bite down. Long-term wise, when left untreated, there's more wear and tear on the teeth, and most of all, it does affect patient growth in terms of how they should all fit together. Another problem that we run into is protrusion of the teeth, or when the front teeth basically stick out beyond the normal. 30% of kids that have this sort of issue, well, we all like to run around and play, they run at risk of actually causing permanent damage to the teeth when they fall. The lips don't close over completely comfortably to give that layer of protection. Jaw growth issues that can affect the bite and facial asymmetry and growth of the patients. Early treatment allows us to guide the jaws and the permanent teeth to erupt and grow into the ideal position. By doing this, you can actually prevent future problems that get much more complex, way more challenging to correct later on. After a consultation with your orthodontist, and now let's say your child is recommended for early treatment, what does this typically entail? There's a variety of methods that could be recommended for your child to actually receive treatment. The first most popular one is actually an expander appliance, where it actually widens up not just the teeth, but more importantly, the upper jaw can actually widen up the jaw, create a nice wide smile, yes, but more importantly, actually also gets them out of that posterior crossbite or anterior crossbite to allow also the permanent teeth to fit in. That way the top and bottom teeth can actually fit together in the more ideal position. Another means is also partial braces. Some braces on the front teeth and the bottom teeth just to kind of close up the gap that may be created by the expander appliance. Get them nice and lined up, allowing for the permanent teeth to come in normally. All of these appliances are designed in some way, shape, or form to allow space for the permanent teeth to erupt that are most important for the smile, or to even guide the jaw growth. It's natural for parents to have the normal questions. Number one, is my child going to need braces twice now? Once at 8 years old and one more time at 12, 13 years old. Is it going to cost more? Why start treatment so early? These are all really, really typical questions that you may have. I'm going to share with you my personal philosophy and how we do things at Excelsior Orthodontics. We ultimately believe in just being honest and transparent with patients, being honest and transparent with parents. I get it. Life can get really, really busy. You have kids to raise. You have a family to take care of. You have work. Typically, my patients have to fall into one of those major categories of correction, crossbite, severe crowding. That can be for impactions. Teeth have to stick out. Outside of those things, if they don't fit in those categories, I'm not going to recommend treatment. If I can save you time from off of work, from having to pull your kid out of school, take them to their orthodontic appointment, if I can save you money, if I can make your time more efficient and be able to say, hey, I can treat your child, accomplish your smile goals in one round of treatment closer to age 12 in a shorter amount of time frame, such as 18-24 months. I think this would be more ideal than having to break it apart, honestly, for no reason, having to do 1 to 2 years of treatment at an early age and another 1 to 2 years at an older age. I will absolutely recommend one round of treatment. Now, after a consultation, and let's say I recommend no treatment is needed, we will place your child in what we call observation visits. What does observation visits actually mean? I simply take a few minutes around every 6 months to observe if there are any primary teeth that are a little mobile. I like to observe periodic radiographs of all the permanent teeth to watch them erupt in a normal way. So if we do run into a problem that we didn't see early on, we see it like a year later, we're ready to intervene and take action and maybe recommend early treatment if needed. So you're wondering, like, what are the chances that my child will actually fall into that category of early treatment? I have to say, empirically, in my experience, I find I only recommend 10 to 15% of my patients actually need early treatment. Phase 1 treatment and early interceptive treatment is really about identifying the specific problems that there are. They need to be very, very specific as far as what are you trying to accomplish. Once those things are addressed, treatment should be over. So the majority of my kids that I see are actually an observation visit. I'm just watching them grow up. I'm watching permanent teeth come in. Of the 10-15% of patients, when they do get treatment, they are so thankful that they actually did. The parents know that they're trying to prevent a specific problem that we identified together that would have made their life and dental treatment a lot more complex when they're 10, 11, 12, 13 years old. Thank you very much for tuning into the Excelsior Orthodontics YouTube channel. If you enjoyed the content, again, be sure to hit the like button, hit the subscribe button. It would definitely help this channel grow. I look forward to seeing you guys soon. Excelsior.